السلام عليكم ورحمة الله الطلبة. نكمل part 2 of our lecture of lecture 1 of endocrine disease, and we continue the hypothyroid condition, and we start the screenshot, and the hypothyroidism, the causes as in case of hypothyroidism, we're having the same differentiation, having autoimmune, like in case of antibody affected the gland, and having secondary or induced by the drugs or by the surgery or by the exudate or by after thyroiditis. We can get the hypothyroidism condition in case of the Cardian thyroiditis, or in case of myxoedematous in case of mountain region, congenital or infiltration or secondary hypothyroidism. We have the clinical feature of those patients. We're having the loss of T34 causing decrement of the metabolic rate of the body. So the heart rate will be reduced, GIT motility reduced, CNS function will reduced. So the patient will become constipation, boy face, and apathy, and poor concentration, and so on. So with accumulation of mucopolysaccharide, with content sulfate, with the fluid causing boy face and increased body weight, and the patient with even having carpal tunnel syndrome, which is compression of median nerve by the oversecretion of mucopolysaccharide. Also having myxoedematous coma, اللي هو accumulation of the fluid in the leg, and sometimes the patient having vasoconstriction with anemia and carotenoemia, so come with lemon yellow color. This the typical feature of hypothyroid patient, having boy face, brittle hair, and even a slow volume of the voice and slurred speech. And the good doctor can diagnose hypothyroidism just by talking to the patient. Just we talk to the patient, we know this patient has hypothyroid, okay? By the speech and by the apathy of the patient. The thyroid function test, TFT, required for the measurement. It's not required to be special time or timing for the measurement. Any time we can send for TFT. No need for the timing or for induction test for TFT, thyroid function test. We send for this test as this diagram shown, and we have TSH, T3, T4, and sometimes we send for free T3 and free T4, and we interpret this result either hyper or hypo, or either secondary or primary, and so on. So the manifestation can be seen here. We have the hyper or increased creatine phosphokinase, increased AST, increased LDH, and also have secondary hypercholesterolemia, which is secondary hyperlipidemia, has anemia, which is non-monocytic non-chromic, and macrocytic because of loss of B12, and also dilutional hyponatraemia seen in those patients. Treatment by thyroxine. Thyroxine, we start in small dose, 50 microgram per day, and increase gradually every week till we reach the perfect dose, and we repeat the test after 1.5 months to see the response. Usually, the patient require 100 to 150 microgram per day, some 200. Okay, this drug thyroxine having long half-life, so given once daily, usually in the early morning, and the patient feeling better after 2 to 3 weeks. But the skin changes and the whole manifestation require about 3 to 6 months to disappear. We have two tricks. Thyroxine used in case of ischemia. Usually, most patients with hypothyroidism are elderly. So, in case of patient with ischemia, we should start thyroxine as small as dose possible. اللي هي about 25 microgram per day, and increase every week to reach the maximum tolerated dose with the normal TSH level. Why? Because thyroxine can induce tachycardia and can induce ischemia and even arrhythmia. So we should start treatment gradually. Second trick in during pregnancy. Those patients, female, pregnant, and having hypothyroid, during physiological changes of pregnancy, we get low T3, T4. But why? Because of more protein bound and requirement of the body requirement. So the dose of thyroxine increased in the second and third trimester of pregnancy. So the emergency in case of hypothyroidism we have emergency اللي هو business coma اللي هي causing rare condition تكون fatal and mortality reach to 50% mainly in the elderly having hypothyroid undiagnosed or poorly treated and getting pneumonia, getting infection, getting stroke, getting heart failure, getting sedative drug, causing decompensation and causing severe illness will come with depressed mood, having unconscious, having heart failure, hypothermia, and so on. Those patients require rewarming and require parenteral T3 اللي هو triiodine thyroidine اللي 20 mg daily induction and then 20 mg by 3 till the patient get improvement and get oral treatment and give him and thyroxine treatment and control. Some patients having secondary hypothyroidism. Secondary acquire supportive steroid because we expect having also secondary hypoadrenalism. So require steroid use. Also giving antibiotics, including infection, and control sodium level, control the fluid hemostasis, and also rewarming of the patient. Some condition, we have three conditions اللي هي يكون asthmatic condition. We have the condition where the patient يكون T34 يكون normal but we have high TSH. So this considered subclinical hypothyroidism لأنه ما سمحت الهايبوثايرودism يكون low T34 normal T34 but having high TSH. We call it subclinical hypothyroidism. So this patient require follow-up because most patients in the next months or next year will having full picture hypothyroidism. So some reference advice to do give treatment, some reference advice to follow up. The reverse also common اللي هو subclinical hyperthyroidism يكون normal T34 or abnormal with suppressed TSH. Those patients also having sequelae, having AF, having osteoporosis, and even have failure. So those patients require treatment and to control the condition of patient prevent complication. The last topics اللي هو non-fatal illness اللي هو sick thyroid. The patient when get severe illness like sepsis, like severe infection, RTA, trauma, and so on. And the patient will affect, this insult will affect the body metabolism, body function, causing disruption of the T3, T4 conversion and T4 to T3 conversion, effect on TSH secretion, effect on the protein binding, causing abnormal TFT, causing high low TSH, high T4 and normal T3. So causing the manifestation of normal T3, but the condition not perfectly diagnosed as thyroid illness. This condition, we call it sick thyroid by the severe insult, and this requires a specialist to control the condition and treat the underlying cause. And we finished our lectures of the first lecture on endocrine, and see you and thank you for listening.